It's like Aerolase, the same.
Same protocol.
Yes.
Like rosacea.
Like rosacea, the same. You use collimator lens, 3 4 passes, and after focus. In acne, better with acne. It's faster, yeah.
I am the Israeli.
Yeah.
So you take Rakutan, low dose, and you get result. That's it.
Don't want that.
No, if you're afraid, if your patient afraid, it's okay. You can treat.
Then give them Vapen.
Or ketamine with a little bit fentanyl.
But
Because otherwise,
if you
it also smoke is off your arm.
and actually
It's not working.
when you use retinoids in combination with neodymium laser, you have no to use it 6, 7, 8 months, just 1, 2, 3 months, just for this period of acute treatment, acute inflammatory process. It's no need to make this typical protocol with high doses. So it's very safe. It's very complementary for patients. They very for you for more trusting effect from patient to you. Sorry. When we speak about ablative lasers, we mean 2 types of lasers: CO2 laser and erbium laser. CO2 laser is more popular, as we have a lot of kinds, a lot of companies produce CO2 lasers, but erbium lasers have advantages comparing with CO2, and the main advantage of erbium laser is the opportunity to work with dark skin types, like 4, 5, and even 6 phototype by Fitzpatrick. So for your country, for Israel, of course, it is a machine of machine with preferences. So we name the second name of all erbium lasers is the cool lasers. Cool, it means that yes, we don't have a big quantity of coagulation. Ablation, yes, but coagulation is very, very small percentage, and I will show the water. Yes. So we have fast recovery, and I will show you on pictures how it works. Moreover, when you take the lens of erbium laser, you know directly how many microns of skin you peel off. When you work in CO2 laser, you don't know, because you can put a pulse inside skin, and it's not controlled process. So as for me, it's very different. Lasers, I use both erbium and CO2 laser, and even we have in clinic the third one ablative, but they company calls it, it's not ablative, it's like a Fraxel. It's a thulium laser, but it has advantage distinguish these 2 lasers, but erbium is the middle of this laser and more safe than CO2, but more effective than thulium laser. So this is a short schedule of our today presentation of this laser, so we don't stop here. You can work with these lasers both effectively with aging processes. This is the sun damage, it's melasma too. If you will combine with neodymium laser and topical products, tone and texture, crow's feet, smoke wrinkles. Even you can take patients with young skin, but for example, large pores, it's okay. For useful for urination, everything. And of course, scars. Scars, I love to work with scars. And my first time when I started to work with erbium, I thought, it's like a toy, not effective after CO2. And I really, from my first patient, I received the complications. It was very aggressive resorption because I remove layer from layer, not like in typical protocols when you started to work from mode 1. I started to work from mode 5, exactly. And I want to tell you that it's not easy machine. It's very effective, very strong machine. So I advise you, if you started to work, start from low parameters. It's more aggressive than neodymium laser. Why this laser is too small? Because this machine have water circulating and optical cable subsystems outside eliminated. So here all this water, all this added maintaining engineering constructions are inside laser. Here, our lasers, both this and this, work with air circulation cooling system. So, in handpiece. So here, this workable part, all is in handpiece. Laser, air circulation, and it's very important to care about your laser. I will show you how. This is a typical picture. All of you know this picture, and absorption of chromophores. You see two peaks of neodymium laser in pigmented, in melanin and hemoglobin. When we speak about erbium laser, the mast is the mast lens, the mast good lens is absorption of water, water and collagen. For me, both water and collagen is the same chromophores because collagen consists from peptides and have a lot of water too, of course, because we work with human, not with cadaver materials, and our tissues are full of water. Of course, when you know now that your patient with scars or with wrinkles, and you will have protocols with erbium, my advice, make previously few procedures of biorevitalizant or collagen products in order to maintain level of hydration of tissues. It will be more effective procedures than on dried skin. The same, short pulse, no overheating of skin, because of this, this procedure called like a cool heating. Here I like this picture. I like this picture because you can see different types of ablation and coagulation. What is coagulation? Here you can see coagulation is a CO2 laser. When we, what is the coagulation? Is overheating of tissues. Of course, somewhere around here on peripheric area, we see collagenegenesis. But close to ablative zone, we, in most cases, we receive necrotic processes, necrosis. So if we speak about short pulse erbium, this one we don't have coagulation, only ablative procedures. It's in Russia it's named плоскостная шлифовка.
It's a one word?
Two. Superficial resurfacing.
Okay.
Yeah, yeah. But I love this word, плоскостная. You can remove layer by layer by layer by layer. Плоскостная. Yes. Long pulse erbium, for example, if we speak about companies, it's BBL, у нас BBL, кто производит BBL? Cyton, yes, Cyton. They have erbium, but long pulse erbium. And in Russia we have not a lot of doctors who love only Cyton, work only with Cyton, all scars on Cyton. For me it's very strange because all scars are different, all patients are different. For somebody we need to make ablative procedures with coagulation. About phototypes, I told you, phototype 4, 5, and 6, you can easily use erbium laser. It safely. With CO2, not. Only first 3 machines, first phototypes, yes. Here I told you about, this is a плоскостная шлифовка, what I told. Yeah, you see very superficial, but you can make big areas, you can work with big areas. It's like a Fraxel, and not ablative fractional resurfacing. I told about Thule laser. It's a typical Thule laser procedure. When it's useful, when it works good, when we want to make drug delivery to skin. For example, you make resurfacing and apply products. Peptides, nucleotides, exosomes, for example, which you can't inject. Yeah. And ablative fractional resurfacing, typical CO2 laser procedure. About results, yes. As I told, more effective than fractional and more safe than fractional and then CO2. Of course, if you work in protocol, if you work out of protocol, like me first time, it was not safe. It was not safe, you have to understand it. I like this picture, and these pictures you have in your papers, yes. The thickness of layers of skin in microns, and you don't need to remember this, but you have to have this table on your treatment room because we know that I will show you, and after we'll back. I want to show you a table. This one. See, energy mode, fluence, and depths in microns. For example, you want to make superficial ablation. You see in your table, for example, epidermis. Thickness 50 to 1050 microns. Okay, 50 microns. 50 microns, it's 25 and 25. So what you have to make? You put energy mode 1.2. One layer will remove 25 microns. Next pass, 25, 15 microns. Next third, for example, 75. Or, for example, you can take just mode 0.4, the smallest, and layer by layer, how many layers? 5 layers. Understand, yeah? So, it's very easy to calculate the depth of your ablation of skin. Understand, yeah? So, for example, you want to remove stratum corneum. For example, useful rejuvenation, white pores for young patient from 10 to 20 microns.
So we start with the
Yes, you can start from 0.4 and make 1 or 2 pulses. I will show you. It's enough. It's very easy, no downtime.
that is where we
Yes, yes. If you see a scars, for example, of course you need more passes. But it's very easy to calculate. And it's about 6 millimeters length. 6 millimeters, but we have also 10 millimeters length. 10 millimeters is more mild, more safe for rejuvenation, very good. And you see that fluence more deep, but fluence is less. Here from 2 to 6 and 10 millimeters, 1.5 and 2. More mild length. I will show you on procedure. So let's go back. I just wanted to show you this picture. This is just a comparison with hairs in order to understand how much microns. One hair, normal hair, it's 100 microns. So all this material you have. Of course, typical protocol, nothing new. It's a removing of makeup. For me, it's better to clean skin with chlorhexidine or isopropyl. Of course, you can use isopropyl. Typical contraindications. Pregnant, for me, pregnant is not a contraindication because I show that pregnant is not a disease. But yeah, but if somebody will happen with woman, she will text, it was a dermatologist. It's so it's a lawyer questions, but not medical contraindications. No, why not? Of course, acute inflammations. Of course, it's systemic diseases, but all these contraindications are relatively all contraindications. So I have a patients with many diseases, with oncology. I make procedures, for example, on scars on breasts after tumor of glands removal. Why not? Our patients, sorry? After, for example, a patient receive chemotherapy, surgery, and beans radiotherapy, and have scars. And her oncologist tell her, no, don't take procedures, nothing. You will live all your life with scars. She's a young woman. She's 30 years old, and she wants to live her best life now. Why not? And I treat these patients. It's safe. I didn't see complications or growing of new tumors, so I don't see problems. What about Accutane? Accutane, it's very interesting investigations, research. So if your patient take retinoids, you can make these procedures. It's like the same about neodymium laser, because we don't have coagulation. It's a cool laser, and because of this we don't have post-inflammatory hyperpigmentation, and we don't have big wounds. So you can combine procedures of erbium laser with systemic retinoids or antibiotics, for example. And of course, if your patient have a humanum herpes virus, of course, before procedure, you have to prescribe him antiviral therapy, Valtrex, for example. It's like every ablation procedures. About hydroquinone, yes. There was many research about treating with topical hydroquinone with patients with pigmentation, and there are no evidences with or without hydroquinone. So hydroquinone is not help in treatment of melasma if you treat only with ablative procedures. So as I previously told, if you really want to work with melasma, you have to combine these machines. Not only erbium laser will not treat melasma, will not treat, and even adding of hydroquinone will not help you. Understand? Retinoids is okay. After procedures, you have to use topical products with regeneration components. I love to use these products with exosomes, American products. I see you have a lot of products too from Tuscany. You can see even Cicabio cream by Bioderma. It's good product too. Of course, with SPF. Downtime. This is not. This is pictures from my colleagues from Great Britain, but you see that from 4 hours after procedure, we see normal skin. 1 day after, it will be worse. It will be worse. Why? Because of healing process. And you remember from my first presentation that first 24 hours is the exudative phase. But these small wounds after lasers are really small, and this exudation will be inside skin. So you will see like a petechias, yes. Of course, I will show you today how it looks, and after 1 week, you see a result. And here, after one procedure, after 1 week, you see a really great result. But if your patient have a skin laxity, you can see after procedure edema. It's normal too. It's no worry. It's okay. And this swelling, if you have both machines, you can use immediately after low-level laser therapy in order to calming skin and regress edema. I will show you how we combine. This doctor make blepharoplasty. It's not because of laser. Upper blepharoplasty and lower resurfacing. And you see this. I think here is better on computer, but you can see. You can see smoothing of skin from this to this just 4 days. And from 20 days, you see densening of skin. It's very good because before our clinic by erbium laser, I made CO2 lasers, and I will show you some patients very difficult heal after CO2 resurfacing. Of course, it's okay, it's normal, but you can see this healing process after CO2. I think it's not comfortable to patient. I will show you. This is after CO2.
This is immediately or after?
Next day.
Next day.
Next day. This one. This is a comparison with CO2 laser. Little bit not comfortable for patients. So now I use erbium laser. It's really better for communication with patient. Patient trust you, patient calm. You can see. Yes. And previously she had injections of collagen, and her swelling is very big because of this too. This is CO2. Yes.
Wow.
So erbium laser is more safe. Yes. So of course, laser safety, you have to work in glasses. Your patient have to be in glasses too, or shields. I prefer to use shields, corneal shields. For example, if you work with crow feet, this glasses little bit not effective because you have to work close to lashes. So you have to use shields. These shields. You have special Yes, yes, yes. And shields, for me it's better. I use these shields in surgery room and glasses for doctor. It's very important. It's very important to remove all jewelry. Yeah, because it's like a mirrors. You can reflect and have a big problems with your eyes. So this is about filters. You have to remove filters. This one filters. You have to remove after using, not from one procedure, but I think 10, 15 procedures, and you have change because there is an air circulation system, and in our clinic, one time we have an accident when doctor didn't remove this filter, and it was like a, как будет взрыв по-английски? Yeah, it was horrible. It was really horrible. Everything is okay. Yes, it was because air. I'm not engineer, but air was because like внутри как бы скопился и вот взорвался. Вот. Ну, короче, you have to change. Yeah. Of course, you work from pedal, and when you, I will show you. When you work with pedal, you just have to put leg on pedal only when you direct on skin, and I will show you 10 millimeters lens with stoppers. I will show now. Deep penetration, but low energy. So you put lens directly perpendicular. No like this. From time to time, it's easy to use angles, but it's prohibited. You have to use only directly, and I prefer to use 2 Hertz, 2 pulses per second, and 0.6. Okay. It's very superficial ablation. Look here, very superficial. So, but if I will make the next part, just one. Yes, just one. It's a coagulation of corneum, stratum corneum. Here is. You can see. Yes, да. А вы тоже по-русски говорите? Понятно. When you see in your tables, you open your tables. Так, а где табличка? Вот. First page. I take 10 millimeters lens and energy mode 1, so it's a 12 microns. 12 microns is a corneum stratum. When I want to take second pulse, it will be how much? 10 20. Okay. So you can see here a little bit a yellow coloration. It's more deep.
It's not burn.
No. These parameters, this protocol, good for rejuvenation, for white pores treatment, not for scars. For scars, we have to use 6 millimeters lens. But yes, it's a ablation of superficial layers.
Это сколько было?
Это было на единичке, да, вот, 12 микрон, то есть уже 24 получается. 12 and 12. And next, if I will make a third part, it will be 36. Yeah. Okay. No, I told about this. No jewelries, no mirrors. It's very important, very important. Here is typical bottoms, like in neodymium. Ready status and alert. Alert is a service. The same. It's a old model. We had old. You have new model. This one. Actually, you have even this table on Leyzer. Very good. We don't have. So these tables with parameters are on Leyzer. Great, super. And D, energy mode, here on this machine is from 0.6 to 1.2 for this lens. And for this lens, I think it will be from 0.4 frequency from frequency from single pulse 0.6, 1.5, 2. Function I use every time only F. For me, it's a classical useful parameter. So collimated lens, actually after such a superficial resurfacing, your patient can see after this test, like in psoriasis, кровяная роса. What? I don't have now, but I see if I will make next, I will have. So it's very, very superficial. Lens 6 millimeters. Normally we use in thick skin, in large pore skin, in scars, acne scars. It's more aggressive lens, and parameters for this lens more aggressive. So I advise you started to work with 10 millimeters lens, because it has stoppers for skin. You no need to collect something, and this lens different from 6. I will show you. In old machine, it was a white collimated. Here you have green or a gray. Sorry. but this is the same like Era, like Neo Elite. This lens is yes, is collimated, and this is focused. They are different, collimated and focused. So this collimated lens is more aggressive. But on procedure, I will show they are different. You see, this one and this one. То есть они направлены на разные, немножко как бы разные показания, но сейчас будет понятнее просто. This one more aggressive, collimated, and less aggressive, focused. And of course, it's depend from beam diameter. Now we will make procedures. It will be easier for understanding. The same what I showed you. How to collect the depth of ablation and how to see it on procedure. So first layers will be white, yellow-white, yellowish, and after you will see bleeding and pink, and you can see bleeding. It's okay, but you have to make special after laser treatment. I told you about positioning of laser, overlapping. For example, if you make rejuvenation procedures, it's okay when you make 20% of overlapping. For me, it's, I love to make more aggressive procedures, so for me, overlapping is okay. And procedure. So I think this about superficial ablation, I think you all know what we have to do. We have to peel off stratum corneum and from time to time stratum lucidum and stratum spinosum. Not damage basal layer, because basal layer have it's a level where growing all next layers, basal layer, and stem cells too. So if you will damage basal, stratum basal, you can receive scars. So don't go to stratum basal. It's very important. Superficial ablation with patients from 1 to 4 skin phototype. It's what I show you. What I show you on my hand. Very easy procedure, effective procedure, and you can very effective use after procedure applying products, exosomes, peptides. It's very workable. It's very workable. Ablation. We change lens. We take 6mm lens. And as I told you previously, we started to work from mode 1. And if you see that not yellowish coloration. You can make mode second, and like with neodymium laser, all is depend from your skills, from your understanding the patient of his level of hydration, previously treatment, pre-laser using pills, for example. If you use pre-pills, for example, acids, glycolic acids, it will be easier to receive results even on mode 1, because you previously using in home 1 month or retinol, topical retinol creams. I love to prescribe patients home care procedures before laser procedures. And you can make from 1 to 3 procedures with 1 month apart between. Is the same. It's just different. I think the slides. It's the same slides. Very strange. Cutaneous lesions. Very good indication for this laser. It's a seborrheic dermatitis. You can use, of course, 6 millimeter lens, and mode 1. It's you have this device here. Very good device. Shield. For example, you choose the size of mole, put, yes, and use and make calculation.
Multiple steps.
Yeah. From here you can use directly from mode 1.2. It's a 6. It's a maximum 6 joules on centimeter square. Mode 1 is a 5. From 5 to 6. It's not too aggressive, but normally you will need 6-7 passes. 1, 2, 3. But you have to see clinically. Today we can show, maybe somebody want to remove his mole. I will show you. It's a typical. I told about this. You have to change. You have to work directly. Of course, you don't. You can't put your leg on pedal when you don't use laser, or for example, only when you make. Yes, sorry. Without lens, of course. And please be careful with patient and your eyes. Isopropyl tissues. Every 500-600 your machine can recalibrate. It needs a few seconds, maybe 30 seconds, when machine no work. Please don't worry. First time for me it was a little bit. I was shocked. This is the QR code of my School of Regenerative Medicine. I told you previously. You can make a picture and come and see about the school, because in my school I speak a lot of about protocols, different combinations of protocols. It's really big program, difficult, and today I can't explain everything and show you everything. It's a really big last. This is my private phone. This one. If you do have questions, you can text me. Okay. Now let's make demonstration.